The American Dental Association is doing a lot in the area of health information technology to benefit members, the profession, and the public. So for instance, right now we have a lot of activity going on in standards development and implementation for electronic health records and for imaging. Big data does relate to the work we're doing. And big data is the culmination of what I look at as a progression from collecting data at the clinical encounter, aggregating that data, either first in the practice, but then across many practices in a pooled database. So that data is aggregated. Once it's aggregated, then you're capable of doing analytics on the data. And analytics then evolves into predictive modeling, and it evolves into the concept of big data. Big data doesn't necessarily look for causality, it looks for correlation. And the correlations have proven in a lot of aspects, including healthcare, to be very accurate. So yes, in the sense that society in general and healthcare is becoming more networked, and patients demand it, regulators demand this interconnectivity. And think of it in terms of what's called sometimes VLR, virtual lifetime electronic record. So all of your data as an individual from all of your providers, all of your healthcare encounters, all of your payment information is aggregated into one virtual record. Yes, I am a dentist, and I'm part of the healthcare team. So dentists are part of this healthcare team responsible for care coordination. Dentists can be a primary care access point into the healthcare delivery system for patients. And so we are intimately involved with care coordination with teams of providers. We need to know information, we need to receive information, and we need to send information as part of that team. I always boil it down to a few key words. What data are you collecting? So what data elements are you collecting? What's the workflow for collecting them? So what is your clinical process for collecting that? How do you display that information in the program or represent it in the program? Then how can you share it and aggregate it? Finally, how can you analyze it? So even if you just want to analyze your own practice data, what's my success rate? How many of my restorations have to be replaced at 2 years, at 5 years? How does that compare to what I've read elsewhere? Or how can I compare that to a national norm electronically? And then finally, I would emphasize usability in all of these characteristics, functionality, so what does it do the functions? As an orthodontist, I'm not an orthodontist, I'm a general dentist, but if I were an orthodontist, I would have a different probably set of functional requirements than a general dentist or a pediatric dentist might. And then what about the interoperability of that information? It needs to be exchangeable bidirectionally. For instance, if you have an early childhood caries epidemic, and every 2 years the child is being hospitalized and having the same teeth restored again, not that it's not necessary, but are there ways to look at this? Are there ways to analyze what is going on? Are there ways to communicate, to center this around the patient, to break that cycle? So I think there probably is, there is a special reason to start this with children, start health HIT implementation. When one thinks about how HIT may affect addressing disparities in treatment among underserved children, I think it can actually enable that treatment, and it can enable access and a better result. I think it's key for pediatric dentists to be integrated with health information technology, with electronic medical records. In addition to that, if you think about that continuum of a lifetime, that virtual electronic record, virtual lifetime electronic record, then it's really important to get the children's records started correctly, get that data entered in a way that's interoperable, and then can be aggregated into that overall record for that patient.